Alright, it's going. Hello, Mrs. Alexander. My name is Candice, and I am going to be doing your head to toe assessment today. How are you? Good. Okay, so this is going to take us roughly maybe about 15 or 20 minutes or so because we're going to go from head to toe. We've already collected your health history, and that's going to help us along the way with the assessment. And if at any time you have any questions, please feel free to ask. Okay? The first thing I'm going to start with, I just want to check your scalp, check your hair and your scalp, and just make sure your scalp is free of any cuts or lesions or any problems. So if you can just tilt your head forward for me. Your hair looks nice and healthy. Scalp looks nice and clear. I don't see any abrasions or any scratches or any lesions. Your hair smells good. Have you been having any painful areas in the scalp or anything? No. Okay. All right, next I just want to look at your eyes and just see if your pupils are equal and reactive to light. So I'm going to shine a light, okay, into your eyes. I just need you to look straight ahead at me. Okay. All right. And the next thing I need you to do, because I'm just going to check your cranial nerves for the eyes, is I just need you just to follow this object just with your eyes, okay? Just with your eyes. Very well. All right. And now I just want to just look at your face, and I just want you to say ah. Okay. Just smile for me. Okay, and just make a expression of a surprised face, of a sad face. Frown, smile. Okay, and I'm just gonna tap certain areas in your face, and you just let me know if you feel any pressure there. Okay, or if any of these areas are painful. Okay. Any pain or tenderness when I do that? No. Okay. Very well. Let me just take a look in your mouth and just look at your teeth. Stick your tongue out for me. Stick your tongue all the way out. Say ah. Okay. Move your tongue for me. Let's take a look at your teeth. I don't see any cavities. Great. And your tongue is pink and moist. Inside of your mouth, your mucous membranes are nice and moist. And I just want to check your thyroid. I'm just going to have you look straight ahead and just swallow for me, please. Swallow. Swallow. Okay, any tenderness when I feel those areas? Okay. Now the next thing I want to do is just to take a look inside your ears. Okay, and turn this way for me. Okay, your mucous membrane, your eardrum looks nice and like a pearly gray. All right, now I just want you to repeat 99 for me. 99. Okay. 99. All right. 99. Again. 99. And we're just checking for tactile fremitus when we do that, okay? I also want to just listen to your lung sounds. Okay? Breathe in deep for me. Blow it out slow. Breathe in deep. Blow it out slow. Breathe in deep. Blow it out slow. Breathe in deep. Blow it out slow. Okay, we're going to listen from the back as well. Okay? Oh. Breathe in deep. Blow it out slow. Take a deep breath. Blow it out slow. Deep breath. Deep breath. Deep breath. Deep breath. Okay, and I just want to listen to your heart. Okay, good strong heartbeat. Nice clear lungs. Now I just want to check the strength in your arms, okay? So what I want you to do is place your palms against mine and push me away, okay? Now I want you to pull away from me. Wrap your hands around mine and pull away. Okay, very good. Squeeze my hands, both of them. All right. Okay. All right, and if you could just lie back, please, for me. And we're just gonna check your abdomen. Okay. And it's free of lesions. I don't see any bumps. I don't see any distension. Okay. Have you been having any problems with your bowel movements?
No.
Okay. So you've been going pretty regularly?
Yep.
Okay. At least daily, or how often?
Every day.
Okay. Nice warm stools?
Yeah.
Okay. All right. I just want to listen to your bowel sounds. Strong bowel sounds. Okay, just take a feel.
Oh.
Any tenderness or pain? Huh?
The tickles.
All right, and you can sit up for me. Okay. And also just let me check here and just cough for me. Cough for me. Okay. Seems intact. All right, and now I'm just going to let me check your feet while we have you laying here.
I have to lay
Just
back
want
down.
to check. Yes, just lie down for me. I'm just going to check for what's called the Babinski reflex, and hopefully it's negative for you. Okay. Pulses here. Okay, check your range of motion. Any pain with that?
No.
Okay, now Miss Alexander, you can sit up and just swing to the side for me. And I just want to check your reflexes. Okay. All right. Okay. And stand for me. Okay. And now what I want you to do is I want you to touch your nose and touch my hand with the same finger. Nose, hand. Now alternate hand. Nose, hand. Nose, hand. Okay. What I want you to do is close your eyes. Hold your hands out to the side. Okay. See if you can hold up one foot as you're doing so. Okay, now try that with the other. Okay, and are you able to bend? Okay, are you able to bend down and touch your toes? Without any pain, turn around, let me see your back. Now bend for me. Touch your toes. All right, very well. All right, now turn around towards me. Shrug your shoulders. Okay, and you're able able to do so freely, correct? Okay. All right. Okay, you can have a seat. Now, I just want to talk to you about certain things about self breast exam every month, and I would encourage you to pick a day every month and stick with that day, preferably right after your menstrual cycle, or at least the after your menstrual period has ceased, or at least the fourth to seventh day of your menstrual cycle. You can do this while you're in the shower when your hands are soapy and wet, and just learn to just palpate your breast area. And if you notice any suspicious lumps or any suspicious discharge or any changing in the texture of your skin, please notify us so that we can do follow up testing, okay? That's very, very important to do this monthly. Try and do it at the same time every month because that will promote consistency. But breast cancer, when it's detected early, you have a good chance for treatment and survival. And it's best to start early, even at your young age. It's best to start this now and get into the habit and practice of doing so. And we will give you some literature on that. Also, at the age of 18, it's best to start with your annual exams with your gynecologist, to have your yearly pap smears, because again, early detection is key with cervical cancer and also with uterine cancer, okay? And I know you've had the HPV series of vaccination, which is a good thing because that protects you against a lot of the strains of the human papilloma virus, which some strains are the causes of cervical cancer. So, do you have any questions thus far?
No.
Okay. We will give you some pamphlets. Also, I just want to make you aware of things like with drug use, tobacco use. Those things are really not good for health. And have you ever engaged in any drug use or tobacco use or unsafe sex practices?
No.
Okay, well, we'll still give you some pamphlets as well, and maybe you can pass them on to a friend because, once again, education is key in preventing, certain diseases and certain complications that can occur. Okay, so if you don't have any questions for me, that concludes the exam, and I thank you for your time.
All right.
Thank you, and you have a good day.
You too. That was so long.
Did I get all of the areas?
It's still going. I don't know. I don't know what